Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Michael Pessman. He's a gerontologist. His most recent Kevin MD article is titled Breaking Down Barriers. Illinois bill calls for cultural competency training for physicians to improve healthcare for LGBTQ plus community. Michael, welcome back to the show.
Thank you, Kevin. I appreciate that.
So we'll get to your article in a little bit, but for those who didn't listen to our first episode together, just briefly share your story and journey to where you are today.
Sure. My name is Michael Pessman. I live in Chicago, Illinois. I have an advanced degree in aging, which is gerontology. I am a gerontologist. I'm passionate about advocating for older people. In this latest piece, I kind of branch out into a different part of my life, although I do think that older people do fit in this piece is kind of a different direction for me today.
All right. So let's talk about this article. What made you write it?
I actually was at a working group back in January, and I met a gentleman by the name of Mike Thury. He's the public policy director for Equality Illinois. And they were talking about a bill that they were trying to bring to vote in the Illinois House. And it was a bill called Illinois HB 4654 that would require physicians in Illinois to get cultural competency training for LGBTQ patients that they have. And they were looking for support, and they were looking for people to kind of, do what they can to bring awareness that this bill would be very important if passed. I want to be very clear. I'm fortunate to live in a city and state where being gay is not discriminated against. I know it's a very hot topic with Florida's anti-gay laws and so many other states, going the opposite direction. I'd like to think that we could go in the right direction here in Illinois. And I'm just very passionate. I am a member of this community, the LGBTQ. I identify as a gay male. So this issue really hits close to home. For years, when I was younger, I was questioning. So I think there's also that part of the community that people often forget about, that can't decide one way or another just for a variety of reasons. So I believe that everyone deserves healthcare equality in the state, no matter if you're in Chicago, an urban area, or a southern part of the state. I grew up in a very conservative part of the state, so I understand, kind of both angles.
How did this bill come together, and maybe give some context in terms of why someone felt the need to bring up this bill regarding cultural competency training?
Very good question, Kevin. Well, we know, and I do mention this in the article, that people in this community are much more likely to experience discrimination, stigma, and bias when seeking healthcare services. I knew that going into it, but it was startling just to see how many articles, are written about this that have been peer reviewed. I mean, they're completely legitimate. And it made me sad that we're in 2023 and we can't overcome some of this stigma and make healthcare available and comfortable for all. And I think it was really that my community has known this for a long time. And because we are progressive here in Illinois, I think that we are, prone to lead the nation in this effort. What I found most shocking, and I have to interject this, Kevin, is that there are no states that require this licensure renewal with physicians. That there is in Washington, D.C., there are nurses that are required, but not physicians to have this training. And another thing I found very surprising, and I go on a little bit in the article, is that medical students actually would like this. And so I found that to be a very good spot in the article, because that gives me hope that for the future, because they'll, our young doctors are going to be leading the way, that they want this training, that they see this as important. And there's actually some pretty good research on that as well. So that was a very surprising, good part of silver lining, I guess, is what I would call it.
So you mentioned some of the stigma and discrimination those who identify with LGBTQ plus when they access the healthcare system. Is this something that you experience yourself? And if so, what does that look like?
It is not something I've experienced myself. I think that I've had friends, I've talked to friends I think that because I live in a bubble here in Chicago, my doctors are very open, and I seek service at Howard Brown, which is very welcoming. They would be on the opposite end of the spectrum. But I've had friends, being raised in a different part of the state, that I had one friend who was not out to his doctor, who was very offended that in the way he was asked to take an HIV test just because the doctor assumed he was gay, but they didn't talk about it. And he didn't go back to that doctor because he felt very hurt. And maybe the doctor was, just trying to be empathetic, but approach is everything. And without having that knowledge, how to approach a patient, there's a disconnect. And that can lead to trauma with doctors. And this person now lives here in Chicago and has come full circle, but it was very traumatic. And this is something that he remembers. That's just one example of many. We want to make it where doctors feel comfortable that they know how to approach these sensitive topics. I mean, they're very sensitive.
So we talk about cultural competency training, and that's a buzzword that, as you know, means a lot of things to a lot of people. So in this context, what would that mean to you?
That would mean to me, doctors would have exposure on how to promote greater equity. It's kind of a social justice piece. It's a way also that they can build trust with their patients, rapport between patient and providers, and it just be a great step towards more inclusive and equitable healthcare systems. And I think it's just the right thing to do in the society that we live in. It is my goal is that everyone gets treated with respect and dignity in the healthcare system.
You mentioned earlier that some of these topics are very sensitive to approach.
Mm-hmm.
Now, what would be some examples or topics that would come up during this training that physicians need to be aware of?
Sure. Well, just addressing that this community has more anxiety and depression than the average person out there. Also, paying further attention to suicidal ideation and attempts. I have many friends that have tried that, unfortunately, and the healthcare setting should be a safe space to talk about why people are having these feelings. And you know, oftentimes there are sexual trauma in people's past. Partner violence is a big thing that's unspoken. And in a healthcare setting, people should be made comfortable to talk about that. Also, for men who have sex with men, there are a number of STDs that should be tested for regularly, such as syphilis, gonorrhea, chlamydia. I'd like to see, that would be part of the training. Having those regular assessment and screenings for STI and also HIV, but in a mindful, compassionate way. Routine vaccinations for hepatitis A and B. HPV is also prevalent in my community. Clinical implications include preventative and wellness care to prevent or treat tobacco use. That is higher incidence also in my community. And just promoting overall well-being.
Now, for those clinicians who hasn't gone through such cultural competency training, what are some red flags? What are some pitfalls? What are some things that they should not do in the exam room?
I think that don't make any assumption that just because you think that someone might be LGBTQ, to ask compassionately, to kind of hint. I had a podiatrist visit a few months back here in Chicago, and he was very subtle. My doctor is fantastic. And just laying a few, clues that he's open-minded rather than bluntly asking somebody. I think that can put people on defense right away. And we want this to be a very welcoming environment. My podiatrist was extremely welcoming. He let me know in his own way that he was open-minded, that he treats all. And also in talking to some students that I did speak to some students that are in medical training, they talked about, even though they have gay friends, that they're going to be a clinician and they're still, they are interested in this training because they want to help people. They're getting into this business not just to make money, but to help people. And I didn't consider that. That was surprising, and also it uplifted me to hear that that students are getting into this business to help people. That I think is forgotten sometimes.
So the bill is Illinois HB 4654. So
Yes.
what exactly does that call for? What kind of training does that call for?
Well, it calls for a certain amount of hours when doctors in Illinois or clinicians go to renew their license. So, I think it could be done online in Washington, D.C. They have this training, this credit hours that they could watch online. But I think it could really transform people, even doctors here in Chicago that live in an urban area. They could learn something. There's a lot that I didn't talk about of the training that could be beneficial, and I just think it's the moral and right thing to do. But yeah, I'm a big proponent of this, and here in Illinois, we would be the first state to do that, and I think that we are poised to do that. We are leading the Midwest in so many areas. People come to Illinois for healthcare because of the excellent choices we have here.
And what's the current status of this bill?
It is dead on arrival. It has been January of this year. It is stagnant. So it needs to be brought back up for a vote. I don't know if that's going to happen, but bringing awareness, such as this podcast here with you today and writing this article, are steps in the right direction to start that discussion. And I'm hopeful that possibly this can be brought back up.
So talk about some of the opposition arguments that you've heard against this bill.
Well, I've heard that there's a lot of hours that physicians have to do anyway, and this would be an added burden. I think they're asking for 12 hours. That could be negotiable. I think that any training whatsoever, I'd be a fan of. So just burdening, doctors are very busy people. I understand that. And that has been some of the negative comments. I will say that the American Medical Association, based right here in Chicago, advocate for this training, not this bill specifically, but for this training for physicians, because they understand that equity, health equity for all is very important.
And my final question, Michael, tell us some of your take-home messages that you want to leave with the Kevin MD audience.
Sure. My take-home message would be that as a society, we have a moral obligation to ensure that individuals receive their health care they need to live healthy and fulfilling lives. And I would ask that everyone would take steps to ensure that this is taken. Thank you.
Michael, thank you so much for coming back on the show, sharing your time and insight.
Take care. Thanks, Kevin.